It is 3:02. I'd like to call the Mason County Community Services Health Board meeting together, and introductions. I see Carrie and Randy and Mackenzie and Lydia and Kevin and Dave and Sharon and Alex and Gary. And Derek. Who else? Oh, Gary. Yeah, who else did I miss? Anybody that I missed? Oh, there have I have Darren. Did I miss anyone? Can anybody even hear me still?
Yeah, I think you're good, Peggy.
Okay. So did I miss anyone? Okay, so can we get an approval of the agenda?
I move that we approve the agenda for July 27th.
I'll second.
Any discussion? Hearing none. All those in favor?
Aye.
Aye.
Aye. Any opposed? Okay, can we get an approval of the minutes from May 2021? Anybody?
I will move that we approve the minutes from the previous meeting.
I'll second.
Any discussion of the minutes? Hearing no discussion, all those in favor? Aye.
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 Any opposed? Okay. Approved unanimously. And so I guess we'll move on to the health officer's report. And I guess Daniel is not able to attend today. Dave, do you have anything to?
Right. So yeah, it's been a busy week, especially from health officers. So at the end of last week, the Puget Sound health officers came out with a not a requirement, but a request that people start masking again indoors. We have a current spike in Washington, kind of our fifth wave. Things are heading back up again. And initially, the health officers on the call on Friday talked about it at length that asking people mask seemed to be the wrong message if we're trying to get people to vaccinate. Why vaccinate if you have to mask anyway? And the governor's office was on the call and weighed in with the same thought. Now today, the CDC has come out with their recommendations that we mask indoors if you're around people that you don't know what their vaccination status is. So that has just changed in the last few hours, and Dan's not on, but I know the health officers are going to be talking about it here in about a half an hour with the administrators. We're getting together to talk about this, and I expect to see something come out from everybody here in the next day.
Okay. So any questions for David on that? If not, let's move on to the administration report.
Okay, the first thing on the admin report, you have my report, the written one. On the call, we also have Dr. Carrie Gardner, who we had interviewed some time back and had offered her the position of health officer, and due to work and travel and other things, she couldn't be here, but we talked about it. She and I have been talking about doing it remotely, much like we've been doing with Dan. So she's sitting in. She has a copy of what I call my rich and famous contract that she's reviewing, and we'll be seeing if we can get her to sign on that. And Carrie, would you like to introduce yourself? Oh, I'm getting a text. Hold on a second. She says she's on the call, but she's not unmuted. So
Huh.
anyway, there she is.
Okay, sorry, I had to do the *6. I didn't know. Hi, everybody. This is Carrie Gardner. It was really a pleasure meeting everybody that I met through the interview process. And I have just been in the process of looking for the other pieces of employment to sustain myself. So with the ability to work remotely, I think that will be very helpful. There was nothing locally that I could use to fill out the remainder of my work week. But I'm looking forward to working with all of you, and it's certainly been a pleasure working with Dave so far.
Great. Okay.
So along with that, we have, like I was talking about just a little bit ago, we do have an uptick here locally. So we went from, and Lydia, correct me if I'm wrong, I'm kind of following along from the fringes here since I'm on vacation. But we went from like having 0 to 2 cases per day, and it looks like we're at 7 cases or 8 cases per day over the weekend. Is that correct? And you're muted.
Lydia, you're muted. Lydia.
She's working on it.
Oh, yeah, she was
Okay.
having trouble with her computer the other day too.
So
There we
anyway,
go. Sorry, my mouse wasn't letting me unmute.
I was about to go with sign language.
With 3 screens, it's kind of difficult. Yes, we're having an uptick, and actually this week we had quite a few. Yesterday, 20 some, so big jump.
Wow, that is a huge. And is it the
And-
Delta variant or not?
We
You don't-
wouldn't know that. We wouldn't know that, but it's families. It's in
Oh.
families,
Okay.
So
large families.
are we seeing that it is the unvaccinated people that are?
Nope, tons vaccinated. Breakthrough.
Yes, we had a meeting this morning at the hospital, and that was that they had very mild symptoms. They said it felt like a cold.
Some. We
yeah,
have
well-
one very, very sick.
Yeah, these were 2
Yeah,
vaccinated
two.
folks that were at a big crowd, and they tracked it down to a big crowd they were at, and they came back and said it felt like I had a cold, so I didn't bother.
Yeah, we've had both mild and very, not serious, not hospitalized, but very sick. And all different ages, from very, from not very young, but from, young adults to seniors.
What about
Fantastic.
the ones that the shots are using? Can you see any difference? Is there a difference between Pfizer and Moderna and J&J?
Good question, but no, we're not seeing any difference at this point. But that's a data that DOH would be tracking, and it probably need a little bit more time before we're going to hear back on that.
And do you know how long ago they were vaccinated?
Varies completely.
But how, I guess when, out of all of the people, are you saying the majority of them were vaccinated and these are breakthrough cases, or?
No, I'm not saying that, and I don't have those statistics. Sorry, Carrie, we don't get that fast.
Okay.
So we'd need time to analyze, and we're not analyzing that yet. We just barely find them, and then we'd have to go back and find out where it takes a few days, then we find out they were vaccinated, or they say they were, but then they still need to be looked at, were they vaccinated here or someplace else. So yeah, we
Okay.
don't have those details, and I don't think the
part
state does.
part of
either.
this, part of this discussion is around the CDC and the state are working on how do we define cases now based on vaccination status, based on if they've had COVID in the past, what constitutes a breakthrough case, what constitutes a reinfection. So more of those guidelines are coming out as the state starts to sift through that data, and we can kind of put some brackets around what each of those categories is and what it means to the community. So Scott Lindquist was talking about that last week about changing the case definitions. And one of the things that they're seeing is people around 11 months are starting to get reinfection rates. So that's something to watch out for as well. So the push really is to get, even if you've had it in the past year, get vaccinated because like Darren was saying is that symptoms are much less, much reduced for those who have been vaccinated. And the message really is get out there and get vaccinated.
Okay.
And then on a happier note, Mason Matters is meeting again. We are beefing up the board. We have the finances squared away. We have efforts going forward. So I expect to see more from Mason Matters on the local forum. Our health educators working quite a lot with the local forum, putting together some of our community health assessment and the community health improvement plan. And I know the hospital's working on their improvement plan, kind of in coordination with that. So we're starting to kind of get back to the business of normal public health, working on community health improvement. And it's nice to see Mason Matters coming back together again and getting our reports. And much of that is due to Lydia getting the computer squared away and getting the accounts redone. So we have people on actually signature forms so we can access the funds. And we'll be looking to really boost that up in the fall as we get rocking and rolling back into the community forum, because that's really where we're going to make our money back in prevention work, is through that community forum. So those are the biggest things.
So do you see, Dave, your team and Lydia, people actually going back and doing the job they were designed to do? Or are we still pretty much nose deep in COVID?
We're still definitely nose deep in COVID, but I'm hiring another position. One of our positions left that was doing the COVID, Chris. And so we're rehiring that. Hopefully that'll go out this week. My staff's trying desperately to get back to their work because they're 16 months behind, and the state's getting real pressy on things, and that's kind of hard. But the amount of, people still getting sick, it's like we got to encourage them to read and remember that they can figure out what to do. They can't be so dependent on calling someone to tell them every step of the way. That's my messaging. This is going to be with us a long time. We need to get the public used to, if you get the flu, you don't normally always call a doc or call a public health department to ask what to do. So it's time that we kind of begin to move people into another area of following, because we as the health departments can't keep this up. I mean, it's a lot. 1 or 2 cases can take a person an entire day to deal with. And it's one thing if they're really sick, or if it's an outbreak that we're trying to stop. That's a whole different ballgame, but this is just people calling.
Right. And part of that is going to be increased with people getting the at-home test kits. So we've got people testing at home, and then I'm not sure what to do with those things. Now we have other testing methods that are coming along that are going to go out in the community, and those actually provide a lab that goes to the state, comes back to us. That's great. But if we're doing all these at-home tests and they call them in, we're looking at how do we define that, and then who enters all that information into CREST.
And who still walks them through what to do, because that's still the questions that come in.
Right.
On a positive note, I want to thank you, because I was told it was from you guys. The hospital is now looking into the parking lot testing contractor so that the hospital is not involved in it. So,
very excited. The state has pulled on some contractors that contacted us, and we don't want to be in the business of that. So we passed on to the hospital, and also I think the hub is now looking to be one in the North County area. We just talked with them today, where there's a drive-through. They're manned by a whole nother agency that's working with the state, and people can drive through and get their testing. What we then need is some still piece for education.
Yeah, it sounds like that not only do they test you, but they also teach you how to do the in-home testing there. And all they wanted from the hospital was a parking lot, a bathroom, and a little space.
Yeah, exactly. They actually set up a kiosk. They bring the kiosk, it's manned, it's 5 days a week. And and they've processed everything, and the test result does go back to the person, and we're trying to clarify, we think it also goes to the state, which is what we need. And that would work better than home testing, to be perfectly honest.
I think it's a good idea. For those old people in the crowd out there, we went from Kodak kiosk to COVID kiosk, right?
And it'll be really helpful for those people who want to travel and need a test just
Yes.
before they travel.
Yes, it'll be wonderful and very available, and the hospital's very excited because they can't staff either. They've got to get back to their business. So yeah, real excited about it.
Okay,
Okay, that's what I have.
okay. Then we'll go on to Alex for the environmental health report.
Yeah, good afternoon. I put together a summary of the past couple months with EH. There's a few things on there for water quality, and then we added 2 new staff members. So that's exciting for the workloads that we're dealing with. Aside from that, not much more to report out. We're busy chasing down permits and complaints and everything else in between. So before I dig into our code updates, does anybody have any questions on my report or anything for EH in general?
It's a lot to wade through. You've done a lot. Oh, on your report? No, I was
On the
talking about
report, though.
No,
Okay.
it was
All right.
fine.
Well, on the code updates, I'll kind of provide a quick overview, and then just looking to collect any feedback from you all on it. So the updates that we got today are in our sewage code, which is in relation to our sewage program here. We've already had our sewage advisory committee review these changes, which they voted in favor for earlier this month. And note that this committee, it includes contractors, realtors, installers, designers, maintenance specialists, shellfish growers, all intended to capture, the on-site sewage industry and all the various partners that it touches. This chapter, Title VI, is under the authority of Board of Health. For those who don't work in codes and our EH requirements very much, this is under your authority, but it also requires review by the State Department of Health. So today I'm looking to provide you kind of an overview of what we're proposing, answer any questions, and then proceed with a Department of Health review. And then we could come back in September, do kind of a final review of any changes that may have happened, and then a recommendation to the Board of County Commissioners. This is how past chapters under Title VI has kind of gone through revisions. So overall, we're probably looking at a fall time frame here, and then probably an effective date, just first of the year, provided we stay on point with this schedule. So our sewage program is based on a combination of state codes and then our local codes. In addition, there's state and local design and construction standards that we follow too. The overall purpose of all these rules is just to manage on-site sewage systems, make sure they're designed, installed, operated, and maintained properly, as well as some general, requirements to dispose of sewage properly. Overall, to protect public health, as I've explained before, a lot of environmental health programs, we're on the preventative side to prevent public health illness from occurring. And the state, in review of the state code, it leaves gaps, and it does this a lot of times intentionally, where there's items that they think would be better addressed locally. And so, in short, we're looking to update these local codes and address some new gaps that we found throughout the last 10 years since it's been updated. And overall, I kind of see this as like a maintenance of our sewage code with a couple things that, are bigger items that I'll review. So I also want to highlight that our state code, which is 246-272A, is in the process of going through the State Board of Health. And with COVID, it's kind of got delayed, and they're looking at implementation in 2023. So we have some time on that, but we're watching it, and as we get closer, I'll keep you all updated. I included in your packets the strikeout version of what we're proposing and what the Sewage Committee reviewed and approved. In addition, I also provide kind of a summary for you on the changes we're proposing. I could kind of go through some bullet points and highlights if you want, or we could just open this up to discussion and questions. I'll kind of leave that up to you, Peggy. Do you maybe want to weigh in on that?
Okay, yeah, that's, does anybody have any questions for Alex on it? It's quite a bit of material. I read through some of it, but,
So if you'd like, I could go through these changes, kind of a quick summary of each. If that would be helpful for everybody.
that would be helpful for me.
Okay. So to start, pit toilets. Pit toilets is basically your old, that you see in the old Western movies. It's a hole dug in the ground with a structure built on top with the moon cut out of the door. We also call them privies. We used to actually permit these things quite a bit. So we have some in the county, but state code, it may surprise you, the state code actually still allows these things to get installed, but there's lots of requirements around them as far as soil depth and soil types. And then with surface water setbacks in our county, I would say 75%, if not more, of the county is eliminated by these requirements already. We get lots of questions and people trying to put these things in. I think it would help us out with enforcement efforts if we could just say this is not allowed. With the amount of lakes and streams and just sensitive areas in our county, I think this is appropriate. There's been other Puget Sound counties that have taken similar action. The few places like maybe a state park out in the middle of Tahuya or something that may meet all those requirements, there's always a waiver process that we could entertain if that situation did occur. So we're talking about prohibiting those. The minimum standards, we're looking to adopt our building permit policies. So a lot of our building permit review processes are all based on some building permit policies that were reviewed and approved by Board of Health back in 1997 or 98. And we still operate under those today. We're not looking to make any changes to what we do with building permits. We're simply trying to codify some of the stuff that we do. A lot of, our Title 15 talks about, just meeting health code. It's pretty vague. And then we have some development requirements under the state. It's just a form of being more transparent with the public, I think, as far as what we're currently doing. So we're talking about adopting that. The permit review time, currently our code states that we would allow 3 years for a septic system to be installed. When it comes to repair of failed systems, we've been requiring less of a time. It seems silly to allow someone 3 years to install a system that's surfacing. So we usually put a 1 year time limit on those. We're looking to update our code in relation to that. Sewage disposal requirements is an added section that a lot of other counties I saw had and that we were lacking. Again, this goes back to some enforcement situations that I think this will help us out on. It's just being clear, basically, if you're creating sewage, you need a proper and approved form of disposal. We have some enforcement code language around, surfacing sewage and disposing on the ground, but we don't really have something clear like this currently that states, you need an on-site septic system, you need sewer, large on-site, you need one of these things to be in place if you're, in creation of sewage. O&M sale requirements. So this is maybe a little bit bigger one. Keep in mind this change is these requirements are already in place. We require at time of sale the septic system to be inspected so that the buyers are aware of its condition. For gravity systems, we allow a pumper to do that inspection. And overall, throughout the past several years, we've just experienced some problems with that. Pumpers are kind of hit or miss on whether or not they're doing a thorough inspection as it's required. And in talking with our sewage committee and the realtors that are on that committee, we feel like this is more consistent. Much of our systems already require an inspection by these maintenance specialists. So this is just it's kind of simplifying our code and saying a thorough inspection must be done with all system types. and an O&M specialist is the person to do it. Again, we had discussions on that with our sewage committee and the realtors there. You know, they brought up some concerns, but overall they were very supportive of this. So the contractor review board, this is a section of our code that we do not currently do anything with. So we certify our septic installers, pumpers, and maintenance specialists in our county. And then when this code was created in 2009, we came up with this contractor review board to oversee administrative functions, enforcement on these contractors. And we just don't run across this stuff very much. Most of the time, a contractor, if they're doing some sort of violation or having an issue, we can usually resolve the issue with a simple phone call or a letter, and they're, you know, back in line with things. If needed, you know, we have a Board of Health here, and that's how most counties operate. Is if there is a contractor issue, we would be taking it to Board of Health. This contractor review board is not active, and it's just a lot of time for staff to maintain this type of thing. So not to mention with it not being active, if we were to run across an issue today, we would have to stand up this board just to oversee that issue. And it just doesn't make sense to me. So we've got a few things within the code revisions that talk about this. So we're eliminating the contractor review board and replacing it with Board of Health. Under our enforcement section, there's some missing language around the term non-occupancy and our ability to condemn an establishment for lack of sewage disposal requirements. And it's pretty vague as it sits right now. We've worked with the sheriff's office before, and they've asked questions as far as kind of what this means. And so we've added some background language to that, as well as you know, some uniformity for staff on how that type of notice should be delivered so that the property owners are aware. And then also under that enforcement section is where we added the contractor enforcement process, which kind of reorganized that stuff. The appeals got a small language update, I think, because of the contractor review board again. And then we added a waivers section. I'm kind of surprised we don't have this in there. We have waiver sections in our other chapters under Title VI. And with the amount of waivers that we process under environmental health, I'd say probably 95, if not more, % of waivers we process is related to sewage. So again, this is just kind of a cleanup of our code, and just provides that authority to provide a waiver if needed. That's kind of my overview. Questions, and again, we're not adopting this today. We are simply just kind of looking for a thumbs up, on the right track, Alex, and I'll send it to Department of Health for review.
I think you're on the right track. Anybody else have comments?
Yeah, it's just a quick question. How do you see this complementing our clean water district that we adopted a couple of weeks, or I guess a couple of months ago at this point? How do you see those two sort of this and that kind of complementing each other in sort of the shared work?
Yeah, well, clean water and anti-septic system maintenance go hand in hand, especially in our county. You know, we have over 26,000 septic systems in our county. And while we do have sewered areas, we've got a lot of shoreline areas that are served by septic systems. So, you know, some of the changes around, you know, like for instance, the property sale requirement, you know, that will help get systems inspected more thoroughly and failures found, you know, at time of sale so that they can be corrected, you know, by the buyer, seller, however it plays out. But yeah, overall, there's a couple changes in here that will help us keep septic systems maintained and fixed, you know, in a timely manner.
And we have a couple months to actually look at this. Well, the state has to look at it, but I think if we have any questions, we could probably email you.
Yeah, I've gone over, you know, our authorities and kind of how this has played out in the past as far as these updates. I think it makes sense to run it through Board of Health. They kind of provide their recommendation for adoption, and then we'll go to the Board of County Commissioners to hold that hearing and then adopt. We may not have to go through both boards, but to me, I don't think it hurts anything. It just provides more public transparency and just make sure we're kind of covered on everything. So we do have, there's going to be, yeah, like you said, several months to weigh in. If you guys think of questions in the meantime, or things that you maybe think we're not addressing here, do reach out and let me know.
Anybody else have questions for Alex? Okay, I guess we'll move on to Lydia.
Thank you.
Thank you.
Well, at first, I guess I'll ask if anybody had any questions from our community health report, from all the different programs and everything. Glad to answer any questions. And then basically Dave kind of already covered some of the things I was going to cover. So I'll add just a little community health education and assessment and data. He talked about Mason Matters. The other part of that is our community health coalition, which has been sort of under the radar, but still kind of moving ahead slightly during COVID. Melissa now has been jumping back on and starting to get things revved back up. And part of that is going to be improving and working on the healthymasoncounty.com website, which is what we call our live stories. You've heard it nicknamed that has a lot of resources for the community, and we're wanting to really push that out this year. So she's going to be putting a new facelift on it. So the address is healthymasoncounty.com. That's kind of going to be our Mason County health website, because it's going to be with all the partners. So it's not just Mason County. We're going to have logos from all partners. Mason Matters is part of that. And we're going to be kind of moving that forward. She's also been working on the most recent updated assessment for Mason County, all of the data, and that will be ready for the next Board of Health meeting in September. We'll be presenting all of the new data plus the community health improvement plan recommendations that would have come forth from the coalition. We're also working with Cascade Pacific Action Alliance, our regional accountable community of health, in aligning with our priorities with the state and our region's priorities, as they also give some money to fund our coalition. So we'll be giving more information on that, and then hopefully being able to share the updated website with all of the data and all the information and all our partner information on it in September. And then the only other thing was, we already talked a little bit about COVID response. It is continuing, trying to find a new staff member to help take some of that burden off of my staff so they can get back to their regular grant work. About half of them have been doing their grant work the whole time, and the other half are basically the COVID team and have been focused fully on COVID. Plus our communicable disease nurse needs to get back to other communicable diseases that are going on. So we're kind of working on making that shift. I'll finish if there's we have a proclamation to put out today, and we didn't get it on the agenda, but it was in your packet. And that's the proclamation about August being Overdose Awareness Month. And we're getting close to that. So if it's okay, I'm going to read that real quick. Whereas Mason County recognizes August 31st, 2021 as International Overdose Awareness Day. And whereas the aim of International Overdose Awareness Day is to raise awareness, reduce the stigma of drug-related deaths, remember those who have died or suffered permanent injury because of drug overdose, and encourage discussion about overdose prevention and drug policy. Whereas overdose is now the leading cause of accidental death in the United States and the 5th leading cause of death overall. Whereas no community is immune to drug overdose, including our own. Whereas to help raise awareness and fight the stigma surrounding overdose, community members can attend our Overdose Awareness Walk in Shelton on August 31st and in Belfair on September 1st, both starting at 5:45 p.m. Now therefore, the Mason County Board of Health does hereby proclaim August 31st, 2021 as International Overdose Awareness Day and the month of August Overdose Awareness Month in Mason County. We call upon the people of Mason County to observe this month by helping our families, friends, neighbors, coworkers, and leaders better understand overdose and how it affects our community and how it may be prevented. So that is the proclamation that we're wanting the board to approve and sign off on. And then we have a press release that would go out on August 1st about this proclamation and Overdose Awareness Month and Overdose Awareness Day.
Any discussion?
No, Peggy, but I would move that we approve the proclamation.
Do I hear a second?
I'll second.
All those in favor?
Aye.
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 Any opposed? Okay, there you go, Lydia.
Thank you. This will be year 3 for this. We didn't get to walk last year, but they're walking again this year. So everybody's kind of excited about it.
Great.
you.
Okay. Any other business or board discussion? Anything else? Okay. Hearing no comments, do I hear a motion to adjourn?
So moved.
Thank you. Okay. Do I hear a second?
Second.
All those approve?
Aye.
Aye.
I guess we're adjourned. Thank you.
All right. Thank you.
Everybody.